And October is National Physical Therapy Month, and this morning we are learning everything about what a physical therapist does.
Yes, and we have Andrew Tomes coming over. He's going to join us from Seton.
Hey, ladies.
Hello.
Hi, welcome.
We're happy to see you. So, physical therapy, what does that mean? Do you have to have had an injury, or should you do it anyway?
Usually you have to have an injury to
Okay.
get physical therapy, and physical therapists get quite a bit of training. Used to be just a master's degree, now it's a doctorate degree.
Wow.
And we specialize in physiology, anatomy, injuries, biomechanics, modalities, and a few other things. And physical therapists will practice in various settings, everything from the hospital setting to rehabilitation centers, outpatient, home health, and various other settings as well.
Wow, a lot.
Yeah,
quite a bit.
definitely. I was telling Noelle, my daughter broke her ankle, so we went to a series of physical therapy
Yep.
treatments after that. And some of the things didn't even, in my head, didn't make sense with healing her ankle, but I guess I know like what to do and why it makes sense. Even the smallest little thing can
Yep.
really change your whole movement and sense of being, right?
Yep, sometimes it depends on the injury as well. You go through various stages. I mean, physical therapy could start in the hospital setting initially, where you might not even touch the ankle. You just learn to walk without putting any weight on the ankle, for example. And then you transition to an outpatient clinic where you might go 2-3 times a week.
Yes.
And your foot comes out of the cast or the shoe or whatever it is, and you start to work on the ankle in a more formal fashion. And then they bend you and move you in various directions, which sometimes can cause a little bit of pain and discomfort.
Yeah.
And they progress you that way.
Wow. So at Seton, what is the most common, I guess, injury that you see there?
So Seton, because it being a hospital and everything, we see everything imaginable, from elective surgeries such as hip replacements, knee replacements. Sometimes you'll have somebody who fell and broke something, so they need rehabilitation with that. You'll also get your strokes and various ailments, COPD, CHF, people with pneumonia coming in frequently, and they become quite deconditioned, and we kickstart that mobility program for them quite early.
So oftentimes there will be this session with you, the physical therapist, and then some homework. How important is it for someone to go through those movements at home to expedite their healing?
I think the homework is the most important part that's often overlooked. You know, physical therapy can kind of kickstart you in the right direction, but if you don't follow through and follow up on things, you are not going to progress as quickly as you'd like to. So it's very important to continue your therapy and your exercises at home, and then check with the therapist. Over time, you check with the therapist less and less as time goes on, so it's really important for you to carry on that homework that's been given to you.
How has your job changed with coronavirus?
What's changed is quite a bit more precautions, a little bit more time consumption, putting on your clothing, your mask, your personal protective equipment and such, and just being a little bit more cautious with extra hygiene, you know, as you go in and out of nursing, in and out of patients' rooms and all that.
I would imagine there are many rewarding parts of your job, but what personally are some of your favorite parts of what you do?
Some of the best parts actually for me is seeing that patient maybe a month and a half to 3 months later in a community setting such as HEB or Walmart or something like that. You see them walking around and you can barely recognize them, but it just gives you joy that you saw them at potentially their lowest point, and now you see them thriving in the community. So it really kind of brings you joy that you know, they've recovered so well.
I was going to say, it's more than just the physical. There's a lot of vulnerability that's shared with you. I'm sure people are at a low point, like you said. And
yes, definitely. I think there's a kind of a hidden psychological and emotional component to all of this stuff that people sometimes, you know, undervalue, because we're just looking at the physical ailment and restoring somebody's body, but all those other components play a big factor.
How big is the need right now at Seton for physical therapists?
Quite a bit. I would say, you know, over 75% of our patients benefit from physical therapy during their hospital stay at some point or another. So they do get, you know, contact with a physical therapist during that time.
You talked a little bit about the training process. If somebody is looking at this as a career, what do they need to be prepared for the road ahead?
So generally, things that may have changed a little bit, but you're looking at an undergraduate degree. A lot of people go to kinesiology or pre-medicine or biology, something like that. And then they transition to the physical therapy program, which is now a doctorate program. So you're looking at potentially 7 years after high school.
Okay. Wow. What about like diet and exercise post physical therapy? How important is it to change the lifestyle after?
I think it's very important. It's very important to get on good, healthy pathways to lessen the impact, lessen your chance for getting another injury, and just moving forward in a healthy way. So it's very important.
Where can people learn more about Seton Medical Center?
So I think we're at Seton, harkerheights.net.
Okay.
Very good, and there's our information on the screen. Well, thank you for the important work that you do and for being here today. We
Thanks
appreciate
so
it.
much.
And coming up after the break, Noelle got a chance to visit the Humane Society of Central Texas and learn everything you can do if you simply just can't adopt right now.